Lower respiratory infections, or LRTIs, are infections in your lungs and airways. Imagine your respiratory system like a tree. The trunk is your windpipe. It branches into smaller tubes called bronchi, which lead to your lungs. When these parts get infected, you have an LRTI. These infections are common and can affect anyone, but they can be more serious for young children, older adults, and people with weaker immune systems. Most LRTIs are caused by tiny invaders, viruses and bacteria. Viruses are like sneaky spies that enter your body and make copies of themselves. Examples of viruses that cause LRTIs are the flu virus and the common cold virus. Bacteria, on the other hand, are like tiny creatures that can multiply quickly in your respiratory system. One common bacteria that can cause LRTIs is Streptococcus pneumonia. These viruses and bacteria spread through the air when an infected person coughs or sneezes. You can also get infected by touching contaminated surfaces and then touching your face. How do you know if you have an LRTI? Well, there are a few telltale signs. One of the most common symptoms is a persistent cough. This cough might bring up phlegm, which is a thick mucus produced by your body to fight the infection. Another common symptom is difficulty breathing. You might feel short of breath, like you can't get enough air. This happens because the infection and mucus buildup can block your airways. Other symptoms include chest pain, wheezing, a whistling sound when you breathe, and fever. If you experience any of these symptoms, it's important to see a doctor to get a proper diagnosis. Once you've been diagnosed with an LRTI, your doctor will recommend the best course of treatment. This usually involves a combination of rest, hydration, and medication. Rest is crucial because it allows your body to focus its energy on fighting off the infection. Make sure to get plenty of sleep and avoid strenuous activities. Hydration is also important because it helps to thin the mucus in your airways, making it easier to cough up. Drink plenty of fluids such as water, juice, and clear broth. Your doctor might prescribe medications depending on the cause of your LRTI. For bacterial infections, antibiotics will be prescribed. For viral infections, antiviral medications might be an option, but often the best approach is to manage the symptoms and let the infection run its course. Always finish the full course of antibiotics, even if you start feeling better. This helps to prevent the infection from coming back and the bacteria from becoming resistant to the medication.